The technology I'm presenting on today is automatic speech recognition as part of virtual speech therapy for aphasia. The application of this technology to treatment of an individual is through feedback facilitated by a computerized system. A patient is presented with a visual stimulus and associated task, which triggers a verbal communication response by the individual. This response is interpreted by the computer system, which provides feedback on their performance. What is aphasia? Aphasia is a disorder that is triggered by injury to the brain, i.e. due to stroke or trauma, that results in impairment of communication methods such as speech, writing and reading. The main goal of aphasia rehabilitation is to optimize the communication between the person with aphasia and his or her environment. The average level of speech-language therapy offered to adults with aphasia in the UK is one 60-minute session every 2 weeks. Neither high-intensity or low-intensity delivery of treatment has been defined as more or less effective, and no specific treatment dose has yet been recognised. There is, however, at the very least, a financial drive to reduce the demand on clinical expertise for treating aphasia, and appropriate rehabilitation technology may offer this. We know that therapies that require an individual to orally express nouns, verbs, actions or sentences from visual stimuli are effective methods of improving verbal communication. This has been studied extensively and is particularly highlighted by Conroy et al. A wide range of therapeutic apps for this purpose have been developed, but have been shown to be variable in their effectiveness. A key reason why this might be the case is that when used independently, the onus is on the individual with aphasia to discern their task performance. Combining unsupervised computerized practice of visual naming tasks with ASR may provide an effective means of intense and low cost and individualized training that mimics that offered by speech-language pathologists.
Voice recognition technology in a lift in Scotland. You ever tried voice recognition technology?
No.
They don't do Scottish accents.
Work on this rehabilitation technology is generally quite limited. Nonetheless, ASR technology itself has seen drastic development via more commercial applications, such as for virtual assistants and smart devices and automated video subtitling. In these systems, algorithms are used to develop predictive models to convert audio data to text. The model is developed by training an algorithm on existing data, such as audio that has been previously transcribed manually. With sufficiently large training data sets, a reasonable degree of predictive accuracy can be achieved. Such complex systems are known as artificial neural networks and have been demonstrated to be very effective in a wide range of fields. At first glance, it might seem that existing algorithms for speech-to-text models could directly translate to this application. But in reality, the problem is more difficult. High inter- and intravariability, such as halted speech, use of jargon and paraphasia, also known as word substitution, as well as overlapping disorders such as apraxia and dysarthria, render universal systems ineffective. Additionally, there are very limited data sets on which useful tools can be developed. So what has been done for this application? In the English-speaking world, the largest publicly available data set is the Aphasia Bank, which stores around 126 hours of video-recorded spontaneous speech of individuals with aphasia. A group at the University of Michigan have attempted to harness this data and developed a deep neural network ASR system that incorporates audio information from the person with aphasia to provide feedback on an individual's clarity, fluidity, effort, and prosody, which is like their intonation, rhythm, and other nuances of speech. There's also work being done in China developing a similar ASR platform based on data from the Cantonese Aphasia Bank and another audio database known as CanPEV. Both projects are at relatively early stages of development. In terms of current clinical application, the only system that exists is a Portuguese-based application called Vithia. It works by presenting an individual with a picture and then ask them to describe it, responding with simple pass or fail feedback depending on their response. In many ways, it is a simpler version of what the other projects aim to achieve, but is an important milestone in the development process. So has it been done well? A key metric of success for this type of technology is the phone error rate, which determines the proportion of sound units that the software incorrectly classifies. When compared to the error rates of manual transcription and other ASR applications, clearly there's a disparity. Of course, this does not necessarily render these tools as useless. In the context of clinical application, despite its widely reported use in Portugal, only one study has been published on the effectiveness of Vithia as a treatment platform. In the study, 28 clinical practitioners completed a questionnaire that assessed Vithia's therapeutic utility, robustness, and usability on a scale of 1 to 5. Common limitations. I previously mentioned the issues of speech variation, co-occurring disorders, and limited datasets. Another major issue is the standard of datasets we have. Aphasia Bank was established for the purpose of allowing practitioners to study aphasia. So the audio recordings on Aphasia Bank are of low quality, which drastically reduces their utility in ASR development. So is there enough evidence to support its use in rehabilitation? Although Vithia is indicated to be perceived as effective by speech-language pathologists, no actual study of its treatment efficacy for aphasic patients has been conducted. Given the status of ASR technology and the lack of large-scale studies on its clinical effectiveness, I believe that there is still significant work to be done before further integration with clinical practice. So what still needs to be done? It's important to realise that ASR is only a precursory building block and not an end goal for speech-based technology aimed toward persons with aphasia. Clearly there are some practical steps that must be taken to render this technology more fit for purpose. Primarily, of course, improving the quality and quantity of input data will strongly improve the quality of the system as a whole. A second consideration is to classify that data and the application of the systems more specifically, for example, to disorder severity, sub-disorders, or even to individual patients. There is also a paucity of commercially developed systems that could be subjected to clinical use, so the development of good user interfaces is also crucial. From the clinical perspective, large-scale studies on self-supervised rehabilitation through ASR feedback are an imperative, as are more qualitative studies on the experiences of aphasic patients undergoing therapy via this method. Finally, it is easy to overlook that models of language are still developing. By conducting focused research on linguistic models of aphasia and combining these with techniques for natural language processing, improved methods of ASR may elicit better therapeutic strategies for rehabilitation of individuals with aphasia. Thank you for listening.